Hi, welcome to Detours Understanding Acquired Brain Injury. This is Survivor to Survivor. And so, as you're aware, those tend to be more controversial. So, if you don't like this kind of stuff, if you don't like anything that's controversial, or you don't like hearing some truth that could be difficult to handle, I urge you to stop now. I'll give you a second or two, and if you accidentally clicked on this, maybe you should go back or look for something else. But if you're into this kind of thing, if you're into stuff that's provocative or makes you think, please watch. All right, so what is this about? What I want to do is talk to you about medical treatments as product. And that includes not only allopathic or Western medicine, but anything like this. Unfortunately, in the U.S. system, well, truth is everywhere, but it's more hidden, is that medical treatments, medications, any of that kind of stuff, labor, it's a product. It is a service. It is sold for money. And so anytime you are getting a service or you're getting a product or whatever, it has cost. And so it requires a bit of wariness, requires thinking. Now, unfortunately, you don't have the ability to make that choice when you're first hurt, when 911 is called, if you're knocked unconscious or seriously injured. You kind of don't have a choice. It's a necessity. Like a utility or something else, you have less control. And, when the ambulance shows up, they're the ones who show up. You're hurt where you're hurt, and you're stuck with, and if they call for a helicopter, that's another cost you are stuck with. But, as things unfold, you end up with a trauma surgeon that you end up with the trauma nurses, the anesthesiologist, the surgeon, so forth and so on. You end up with those. But things you do ahead of time, insurance, who you work for, what's in those plans. It's important to be aware what's in your insurance plan. Yes. To look, to not just sign and that's it. You need to know what's covered and what is not, what costs you'll be responsible for. Those of us with traumatic brain injury or acquired brain injury, we're more likely to have a second or even a third or fourth. Know what's in your plan. Know what's covered. Because you're going to end up bearing more of the cost should it happen again. And it can happen to your loved ones. It's not something you like thinking about, but what happens if it happens to your kid? It can happen. And if you're driving, chances are increased that you will have an accident. It's just the statistics. It's a fact. So you need to look at and think about this more serious side of it. Also, rehabilitation. It's a service by not only the physiatrist, but the other physicians involved and the therapists, counselors, the techs, all that stuff. It's kind of bundled together, but know where you're going. And cost and what you're provided for. You get what you pay for typically. Not always, but typically. That's important to know also. So where you go. Some centers are better than others. It's important to be aware of this. Then when you're discharged outpatient or seeing your PCP, you need to be aware. You need to look. And this is something family can help you with. But still, it's important. And what kind of care you require afterward? TBI, it's lifelong care. In most cases, you'll need that kind of support. And what about equipment? You need to factor this into your budget, and you need to consider it. It's important. What fees are charged? You need to be aware of these things. And keep in mind that there will be sudden problems that crop up. And, trying different medications. Do you just quit? Do you stick to treatments? And you have to weigh into it those treatments that have shown to be more effective. It's worth doing actual research, not just saying, I saw what some weirdo posted on the internet and I went with that, but actually reading stuff that is supported by an academic institution and or something from the Better Business Bureau or any of the Federal Trade Commission, the any of the DEA occasionally will put stuff up. Talk to the pharmacist. Are there alternative ways to, save money? Are there programs that you can sign up for? Getting to know, it's a lot of work. Getting to know what your state provides. Being a brain injury patient is a part-time job at least. So when they ask what you do, I'm a brain injury patient. That is your job because it is a big one. And if you're doing it responsibly, you're checking into costs and what things are, or at least getting help to do that. And asking pharmacists and therapists and other things about costs and ways to do things more within line of what you can afford. If it's too expensive. Some people can just splash the cash and they're fine, but that's not the majority. And that's certainly not the majority of us. All right, what about complementary and alternative? That stuff gets expensive too, and it plays a role, but you need to be aware of being taken. Americans love the shortcut. They love not having to put the elbow grease in. They're willing to physically do the labor for their jobs, but when it comes to actually having to do something hard, there we're missing. We're always looking for the push button fix, the wand waving. Unfortunately, there is nothing. And genuine, real research suggests that really there is no magic cure. And a lot of people will come to you and promise that they've got the secret answer, that they've got something that none of the doctors have. That's ridiculous. If it's available, for one, it's out there. There is no secret cure. There is no way to make you 100%. And, if it were available, it would be available in other countries too. It would be because their systems don't work like ours. Their systems rely on taxpayer-based system all the way. And so they would always be looking for the way to fix the most while spending the least. And so they would look for a system or for a treatment that works for everybody. And so if it isn't ubiquitous everywhere and the insurance companies aren't endorsing it and you have to pay cash for everything, sorry, that's just not, it's illogical because the insurance companies want to save as much as they can. And while not treating at all certainly would, the best treatment is the one that treats the most and gives the most return for that. Because if you can treat a patient all the way back to their old self, no more treatment's necessary. Boom, we've got the answer. And that means we'll pay more for it if it takes care of all the symptoms, or even most of the symptoms. Because then we don't have to spend the money anymore as an insurance company to treat them anymore. Which is why a lot of these complementary or alternative techniques in medicine aren't supported by the insurance company. Because there's really no proof that they do anything. There's no proof that they actually treat or fix anything. They're flashy usually. They're bright, colorful, flashy, glossy, inserts and everything else, or websites and whatever else. And that's also a warning. If you see a lot of gloss and flash for the advertising, it tells you where the money's going, really. As well as usually to the CEO or the executives and stuff like that. Common ordinary medicines, if you look how they come, their packaging is very dull and boring because it's aimed at scientists and researchers. It's not aimed at the family or you, who really doesn't have the medical training to pick out. It's aimed at the doctors. And if you think how they no other country really allows advertising on TV for medications, but it's flashy and glossy when they're trying to aim at you, the survivor, or the family members, when it's kind of like every other product. Make sense? And that's what's going on as far as, a lot of these techniques where there's really no support. And so that's a warning, and that is something to be alert to. The other thing is that there are a lot of untested or undefined kind of things. And it doesn't mean they don't necessarily work, but it does mean there may not be enough research yet. And so maybe it will become the next big thing. But if there's no research, it's still going through those testing phases. And so the best way to become part of those is to search out a major university doing studies and to ask, hey, can I participate in a research study? Do you have something for brain injury patients? A lot of them do, and they're looking for test subjects. Now, of course, the problem here is that you don't know which group you'll be in. Will you be in the experimental group or will you be in the control group? If you're in the control group for an experiment, you won't receive the legitimate treatment. And the experimenters don't know that either. It's called being double-blinded. And so it's really hard when you don't know which one you're in, because the improvement that you may feel may just be due to natural healing, or you've convinced yourself that it works. But that's the whole goal of these experimental studies, is to see whether it's something that you've convinced yourself, or that really doesn't necessarily make a big difference, or if it's actually due to whatever the product, treatment, therapy, whatever it is. So, okay. And lastly, just a couple epistemological razors. I love these. So whatever it is, whether it is Western medicine or whether it is complementary and alternative, if someone comes to you making a claim and they cannot back it up, and I don't mean studies they paid for, and this requires you to do a little work, but if you're going to be spending a lot of money, and they're demanding you pay a lot of money for a study, if they're saying, if they're demanding you pay a lot of money for their treatment or therapy or regime or whatever, they're making a claim without real evidence. If it isn't backed up by other sources, other people not affiliated with them, dismiss it. You need to dismiss their claim, because if it isn't backed up, they want just money from you. And yes, there are people willing to take advantage of you. Absolutely, no matter what their title, whether they've been even a survivor or not. There are people that are definitely out there willing to take advantage of you for a buck. Anytime money's involved, you should always be suspicious, at least a little. That would be, what I would advise for that. And the other one is Occam's razor, which is the simplest explanation for something is often the right one. So is it due to a conspiracy to hide something from you? Sorry to tell you this, you're not that important. I'm not that important. It's okay. It's okay to swallow a little ego on that one and say, no, I'm not that important. Usually if something's messed up, it's incompetence, unfortunately. And related to that, I think it's like Poe's law. I'm trying to remember, I forget. People are promoted to the level at which they are first incompetent. So, somebody who's a great doctor, a great nurse, and whatever will get programmed to, will get promoted to, being a manager or something. Boom, they're incompetent now because they never were trained to be a manager. And that's often why things get messed up, especially in like big healthcare systems. Somebody who is great at being senior nurse or senior doctor and managing suddenly becomes a manager of hundreds of people and now doesn't do any medical care. They're not competent in that job, and they'll never be promoted again. But that's where they're stuck. And systems are not designed to correct for that. And so oftentimes that's why things get goofed up. It's not a plan against you. It's not working against you. It's just big systems are designed to screw up because big business just doesn't care. That's more often the problem. So you have to care. You have to say, hey, and advocate for yourself and say, this is not working for me. This is what I need. Again, it requires that elbow grease. It requires that work. And unfortunately, being a brain injury patient means it is your at least part-time, if not full-time job, and at least a PRN kind of gig for your families. So, yeah, survivor to survivor, being a patient is a job, and healthcare, no matter whether it is allopathic medicine, Western medicine, or complementary and alternative medicine, is a business. And you need to always be very wary whenever you're approaching it. And keep in mind, somebody's looking to make a buck off you, and the thing is that you not get taken advantage of. Have a good day.